Now, I mentioned funding, and I mentioned the fact that Peel it falls through the cracks in many areas, including the mental health area. And I'm going to give you one stark example. Last year in October, Heath Black, who many would know is a former Fremantle Dockers footballer, and a man himself who suffered a whole range of challenges and has dealt with his own mental health and depression issues. Heath came to Mandurah in late last year and presented what was a remarkable presentation to some 450 students from the Peel region. They were high school students, most of them year 11s and 10s from memory. The response and the ability of Heath Black to cut through the whole range of impediments and stigma that mental health conditions and depression can bring, and really zone in on these 450 students was quite remarkable. Now, this program was presented by PIMS, which is known as, or PIMS, PYMS, which is the Peel Youth Medical Service in Mandurah, which is supported by the GP Down South organisation. Fantastic presentation from this man, some workshops that were involved, and a subject including youth suicide, of course, which is so prevalent in our communities across Australia, was addressed by Heath and by the other presenters. The response was remarkable. I want to read a couple very quickly that just give you an example of how much this program and what this program did in terms of impact. From places like Waroona, where, and I want to talk about this, I'm quoting from a letter from the Waroona Community Resource Centre Project Officer and Youth Centre Coordinator, Joe Fraser, which talks about, and this is a regional context, remember, Joe, in the letter of support for a funding proposal as a follow-up, wrote, Heath's workshops are friendly, candid and confronting. Talking honestly about his own experiences allows the young people to feel connected and realise that mental health problems can happen to anyone, including them. The removal of the aloneness of mental health is a major benefit. His comfort in discussing personal circumstances encourages the youth to engage and ask questions, enabling open, non-judgmental dialogue to occur. Now remember that one of the problems for people, or young people in particular living in Waroona, or in towns like Waroona, is the issue of isolation. And that was mentioned in another letter from one of the participants about the fact that they felt like they were understood. One young person who attended said, I would just want to say thank you. This is from Brett, I won't mention his last name. Said, I want to say thank you for the time and effort you went through on educating us about drugs, alcohol and everything in between. The presentation, how you approach things and the way you communicated with us was great. As you said for yourself, you wanted us to approach you as a friend and not as a teacher. I need an extension.
Extension, Grant.
And not as a teacher. So we felt comfortable, and it worked. Your story was quite compelling and touching, and with all your personal troubles and altercations and all your mental health problems, and on what you've done to change everything and pretty much turned your life around. Some of it touched me close, such as the anxiousness, getting out of routine, and other things such as depression and stress. I learned a lot from the time you were here, from the time you were talking to us, and I hope that you can come back and speak to us again about some other topics. Thank you, and I hope to see you again here. Now, look, that's just one of a couple of comments. Now, I focused on Waroona, and I focused on because this is a regional response. This program was delivered to a regional youth audience, not just Mandurah, youth from Pinjarra, Dwellingup, Waroona, were all there, and there was 450 of them. Catherine Shepherd, the principal of the John Tonkin College, highlighted how important this presentation was, and indeed the proposal, which was put to government, would be as an ongoing program in the Peel district or the Peel region. And Dean Snashall himself, the senior sergeant from the Mandurah Police Station, also supported this program, supported the program that was presented and the funding proposal. Now I want to go to the funding proposal. The funding proposal was from the youth mental health, called the Youth Mental Health Program, through the Peel Youth Medical Services. Now I just want to highlight the Peel Youth Medical Services. This is a service that's funded through the GPs down south, and it specifically responds or specifically targets young people. Now, young people present to the PIMS or Peel Youth Medical Service, obviously with a myriad of health concerns or queries and questions, including mental health issues. Now, what happened after that event with Heath Black was the importance of having an ongoing program was seen as so important that a funding proposal was formulated. It was a three-tier proposal. The first tier would be a global ambassador presentation, similar to the one that Heath Black presented. Tier 2 would then drill down to individual schools and workshops in individual schools, and then Tier 3 would be in individual counselling sessions, particularly for young people who either presented or wished to seek further counselling. Now the program was, just in terms of its proposal, supported all of the objectives of suicide prevention and also all of the objectives in relation to addressing depression and health issues, particularly as they affect young people. It was supported by Mandurah Police, the high schools in the Peel Education District, from Maroona, Pinjarra, the chaplain from Pinjarra, Justin Hill, people from the various schools, Catherine Shepherd, John Tonkin College, the Palmerston Association, which has been in Mandurah for 20 years. Again, the Palmerston area, which works, of course, in drug and alcohol in particular, recognised the importance of a program that was being proposed over the next 4 years to assist or to fold in with the sorts of work that they do with families in the Mandurah Peel area. Primary Care WA Chief Executive highlighted it. Counsellors and mediation people, primary school principals even, all of them said, we need this program. We've got a high youth population, massive youth population, and this is the thing that people in this place must also understand. The Peel region and Mandurah is not just a retirement village where most of the people are in their 60s and older. That is now a myth. Yes, that was the case, that a significant number, if not more than a significant number of our percentage of population once was in the senior years. But now we have bulges at both ends of the demographic spectrum. The big bulge is 0 to 15 and then 65 and beyond. So in both ends of the spectrum, if you're looking at a normal bell curve, it'll bulge in the middle. Ours doesn't. Ours bulges at both ends of the demographic spectrum. What does that tell us? It tells us that the growing number is in young people. So what happened? A very good proposal was put to the Mental Health Minister through her department and through the Commissioner. Very, very well researched, evidence-based program. And what happened? It was, I'll tell you how much it was. It was for over a period of 3 years, 3-year funding requirement, 393,000. And that was broken down into the components that I mentioned, the 3 tiers. Only last week, I understand, or early this week, no, last week, no. Government said no. Government said no to that. I don't know what sort of program or what you have to do to convince government about the validity and the value of a program, because they did everything they could. They did everything that was possible to highlight why this program, evidence-based, should be funded. And I've got to tell you, I stand up in this place consistently, highlighting how this region, my region, misses out on royalties for region. People get sick of me saying it. But this is another example of government overlooking the Peel, the fastest growing region in Western Australia, the region that's going to have to, according to your own planning plans for population growth, is going to have the same number of people, equivalent population to that in the southwest by 2031. 180-odd thousand people will have there by prediction. Over 4.5% growth annually over the last 15 years. Much of it in the young family area, much of it in children. And you can't fund a $398,000 program that is evidence-based and will deliver outcomes over 3 years. So I don't know, I'm pleading to you, it's not your fault, Member for Kingsley, but I ask you, I plead with you, if you have a conversation with the Mental Health Minister as a result of the contributions by second reading in the second reading speech, will you please ask her to have a look again at the youth mental health program funding proposal that went before the Commission, that went before her for funding from the Peel region. Now I reckon there'd be almost the same similar program that would work in the Kimberley. That sort of thing would, these are the sorts of things that will make a difference. And look, I can give you every evidence. I can give you a copy of this if you want. But I ask, why is it that a program like this, that is so well researched and evidence-based and has so many willing participants, an eager audience, can't get funded by your government? So, I plead with you, Parliamentary Secretary, to go and bang on the door of the Minister tonight. I'm sure she's still working, and ask her what happened to the funding for the Peel Mental Health funding proposal. I want to finish, so I hope you'll do that. I want to finish on a couple of other things which I think are important in the whole funding model of service delivery. And some of these are a little bit out there, but they actually are delivering in my view. One is, of course, is the June O'Connor Centres that were set up by June O'Connor. I don't know if any of you have met June O'Connor. I always thought she didn't exist. I thought she was like this name, and then one day I met her years ago, and she was one of these, those remarkable people you never forget, because she actually doesn't let you forget her. she doesn't let you forget who she is, but more importantly, she doesn't let you forget about what she helped to establish, and those are her centres that are in her name and that are in the metro area. Now, we fought for literally years to get a June O'Connor Centre in Mandurah, and when we got it, every year since, it's been threatened with defunding. Because again, there was one in Rockingham, they said. There was one in Rockingham. I'm sorry, people with mental health needs want localised services, and they want them in Mandurah, and why shouldn't they have them in Mandurah? They deserve to have them in Mandurah. They deserve to have them delivered where they live and where their families and supports are as well. So every year we used to fight, and I still drop into the Juno Connor Centre in Mandurah, but I'm always fearful that I'll hear or get that phone call that says, David, we're in trouble again or something's happened. It's about treating Mandurah and it's about treating Peel as a major centre of population with all the myriad of needs that a local community needs, wants and deserves. And that goes for the area of mental health. So I would again highlight the importance of initiatives like the Juno Connor Centre, and I would advocate very strongly for the Juno Connor Centre in Mandurah, and indeed would support any plans to not only ensure its continued existence but also its expansion into the future.